Welcome back. Later tonight, do you spend hours sitting at your desk each day? Well, you could spend some of that time doing Derek's disco-sizes, but more about that later. Dr. Joe Tobiansky thought he'd received a death sentence when he was diagnosed with a specialized form of cancer called MDS, but a miracle new drug likely saved his life.
A chance discovery in a small lab in the 1970s in Paro has now led to a revolutionary way of treating cancer. And it's a South African who pioneered this.
The genes that should be on are no longer on because they've been switched off. And the key is that the drugs can actually switch them back on again.
Most pills go through the entire body before they hit the desired area. But what happens when you need your medication to target very specific places, such as a sensitive part of the eye or a cancer cell? They say the eyes are the window of the soul. And for many HIV patients, one of the cruel consequences is that they lose that window. Professor Trevor Carmichael, an ophthalmologist at Wits, has been battling to treat cytomegalovirus in many patients.
It's a viral infection that can affect the retina of the eye, so it causes inflammation and destroys the retina of the eye.
And is it specific to HIV patients?
No, anybody who's immune suppressed can develop this, so you can develop it after renal transplantation or similar conditions where the immune system is poor.
These patients experience slow vision loss over a number of months and eventually go completely blind. The major challenge of treating infections inside the eye is that medicines do not penetrate because of poor blood supply.
Our options to treat this particular condition back in the 80s and 90s was systemic antiviral therapy, which often involved the patient being in hospital because it had to be repeated. As soon as you stopped it, the infection proceeded. So we needed something that gave a sustained delivery of drug to keep the infection suppressed.
There are solutions available abroad, but these devices come at a price.
The latest devices are costing $18,000 now, each one. And we can produce these things ourselves if we work at it.
Back in 2002, Professor Carmichael teamed up with the pharmacy department to develop an ocular implant.
So we can see in the model, on the inside of the eye, we're trying to get the device into this area of the eye. So that's the front of the eye where the cornea is, and this is the back of the eye where the retina is, and this is the lens of the eye. So what we do is we take the little implant, which is very tiny, and we have to make a cut in the outside part of the eye. So we cut through the eye, place the little tablet on the inside of the eye, and then stitch is closed again. And then it releases the drug into the retina.
Professor Vinesh Pillai has been spearheading the development of this technology. One of his focus areas has been to address the problems of continual release of corticosteroids into the eye.
A number of things can happen. One is you get increase in your intraocular pressure that's in the eye. You get extreme eye pain. You can get cataract formation. And you can even get vitreal hemorrhages.
To counteract this, the locally developed device is smarter than its overseas counterparts.
You don't have constant release of drug, but only when the inflammation flares up on certain days, more in some days than the other, then this drug delivery system would actually release the drug.
The need is potentially huge because it affects other areas of ophthalmology where we're trying to deliver drugs. So other chronic diseases, glaucoma, as well as other retinal conditions, diabetes. We can deliver ongoing treatment to the retina.
But this is only one of many drug delivery systems being developed by the Wits drug delivery platform. They're also working on a targeted cancer therapy. When you take a painkiller for an everyday headache, the medicine spreads throughout the body. But the intended pain relief is only from the portion that reaches the head. With a simple headache pill, it's fine, but with toxic medication with unpleasant side effects, it's a different story. Most of us associate cancer chemotherapy with nasty side effects. The challenge has always been to create a high enough dose to kill the cancer without causing too much discomfort for the patient. Treating cancer is much like rooting out terrorists in a densely populated city. You have two options. You either drop a bomb and kill many civilians while killing the terrorists, or you only take aim at the terrorist strongholds. Chief Engineer Professor Vinesh Pillai has combined forces with Chief Intelligence Officer Dr. Clem Penny to develop targeted cancer chemotherapy for ovarian cancer.
We're trying to specifically home in on the cancer cells and target the cancer cells for destruction. The idea being to limit damage to surrounding healthy cells and healthy tissue.
The body's immune system is like a sophisticated army which uses antibodies to identify specific enemies. Targeted therapy attaches the drug to antibodies specific for the cancer.
We developed a drug delivery system that composes of a nanomicelle. It's a very small structure, and it's a micelle. To this micelle, we attach an antibody. And the antibody that we use in this case is something called the anti-muc or anti-mucin antibody.
The antibody then binds to the MUC16, which is expressed only by cancer cells.
This is targeted, and it gets to the MUC16, interacts with the MUC16, and upon interaction, releases the drug at the cancerous site only.
So the chemotherapy will concentrate in large tumors as well as stray cancer cells.
He's going to load a device with the antibody and implant this into the peritoneal cavity. The device will slowly release the antibody into the peritoneal cavity, and it will then find its way to the antigen-secreting cancer cells.
One of the major benefits of this approach is that once the device is implanted, it will slowly release the antibody-linked drugs over a long period, negating the need for regular infusions.
In the case of this type of cancer, which secretes a product called mucin, which helps the cancer cells to stick to surrounding organs. So the antibody will actually help prevent the cancer cells, when they migrate out from the tumor, from sticking to surrounding organs, and in so doing, it will prevent these cells, the cancer cells, from penetrating or metastasizing into neighboring organs.
It's still early days and there's a huge amount of work to be done, but these new technologies have the potential to revolutionize the treatment of ovarian cancer and to keep the lights on for many people who would otherwise go blind. It's nice to know our scientists are up there with the world's best. Now, be sure not to miss Thursday's Consumer Show as we tell you how you can free your home from the grid. And we ask, are cheap leather seats necessarily manufacturer approved?
There's nothing more exciting than buying a brand new car. The gleaming paintwork, shiny windows and tires, and most importantly, that new car smell. And for most of us, the mark of true luxury is leather seats. But not all leather is created equal.